Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Taking a puff of your favorite cigarette or the improved version in the form of shisha starts as a trial, mostly by peer pressure. One by one becomes one too many, resulting into addiction. In 2015, Uganda passed the Tobacco Control Act, which includes a comprehensive ban on smoking in all public places and all forms of tobacco advertising, promotion, and sponsorship. Nearly 10 years later, a new report released by the Tobacco Harm Reduction Uganda reveals that the law is not very effective on stopping the habit. Joel Sawa is the chairman at THR.
The number of smokers has not changed. Okay, it has not stopped smokers from smoking. It has simply driven them to a point of hiding their practice. Okay, it is noted that 10,600 people die in Uganda annually because of cigarette-related illnesses. There's a problem, and the problem is in implementation. You're able to access single-stick cigarettes if you went on the streets. Now, there's another bigger problem, the black market. It's thriving. Smokers keep smoking. Some of them, again, like I said, in hidden places. Some of them in open places, yes. Some of them in their homes. But cigarettes are selling. That's why they're still being taxed.
The report, initially launched on the World No Tobacco Day, was conducted in Kampala and Lira between 2020 and 2021.
We selected sample group of 533 persons. 250 were from Kampala, within the age group of 20 to 34. And rural Lira, we had an age group of 40 and above, the highest marked age being about 85. Only 7.1% have quit, and 6% still smoke occasionally. This is evidence of how addictive the habit is, and it cannot be stopped by simply wanting to quit. Thematic solutions are needed.
Sawa says they further sought to understand the correlation between smoking and education levels, as well as age of the smokers.
User's level of education does not influence his or her decision to quit or start smoking. Okay. However, it is worth noting that from the age group of 20 to 34, the people who had a higher level of education, university level, were more likely to quit smoking. Why? Because we assessed that it is due to the information that they're able to access.
Whereas government is satisfied with the Tobacco Control Act, Dr. Hafswa Lukwata, the National Tobacco Control focal person, says compliance is still an uphill task.
People are defiant, and I think that's a very bad thing. Even where it is for the good of themselves, even for the development, that becomes very dangerous for the people, for the public. I think we need to change our ways. People are continuing to take shisha. It is 5 years down the road since we banned shisha, but we are still getting people taking shisha as if it has never been banned. Then there's also smoking in public places. We are seeing hotels have not done anything in as far as putting into place this policy of no smoking within their hotel rooms or even their hotel compounds. Hotels are supposed to be smoke-free. People are not supposed to smoke in these areas. So for us as government, again, we are having the enforcement of most of the local governments is weak.
Young ladies are noted to be the biggest consumers of shisha for this particular reason, not because of anything else, but because yet in combustible cigarettes, they are the least. Men take the lead, young men take the lead. What does this show? The recreational practice of shisha is what keeps it thriving.
This year's theme focuses on tobacco's threat to our environment, and the Director for Curative Services at the Ministry of Health, Dr. Charles Olaro, says the problem extends to food security.
Tobacco growing requires the use of fertilizers, chemicals which affect the soils. One cannot grow any crops in the land that has been used to grow tobacco. So this brings the issues of food insecurity. Growing and curing the drying of tobacco are both direct causes of deforestation, because forests are cleared for tobacco plantations and wood is burnt. And for each acre of tobacco to be cured, one needs 1 ton of wood and a large amount of energy, water and other resources.
The annual average medical cost of a current or former smoker suffering from a tobacco attributable disease is $1,422, approximately 5.3 million Uganda shillings, more than double that of a non-smoker at $622 or 2.3 million shillings. Treating tobacco attributable illnesses in Uganda is estimated to be $41 million, approximately 154 billion shillings. In 2021, the total health cost of tobacco use in Uganda stood at 126 million shillings. Tobacco use has a growing effect on our environment every year as follows. 600 billion trees are cut down to make cigarettes. 84 million tons of carbon emissions are released in the atmosphere as a result of smoking. 22 billion tons of water are used to make cigarettes. And tobacco smoking results into the death of over 8 million people every year globally. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.